to 94. He worked at Satya Sai Hospital at Puttaparthi in 1994 and he has been practicing urology at Ongole since 1995. He was president of SOGUS AP&T Telangana States in 2022 and he was the organizing secretary of SOGUS conference at Ongole in 2018. Now may I request our dear Purushottam Rao sir to come after the class. Give his please.
And after sumptuous dinners and sumptuous subject, I am taking a lighter subject to entertain you all. Dr. Jayaramreddy sir is a well-known figure in AP and Telangana and also in our country. He did his MBBS, MS and MCH Urology in Osmania Medical College. He was Professor of Urology in the Osmania Medical College for 12 years. When I did PG in Osmania, he was assistant professor and he was the friend, philosopher and guide to all of us. He was the pillar of urology department at that time. I still remember him doing a transpubic urethroplasty in an artistic manner. He is a very cool man, proud father of well-known film director Nagaswin. At the outset, now I should remember and thank my mentors, Professor Reddy sir and Professor Nandyala sir. They came all the way to Ongole in 1995 to inaugurate my practice. Very sweet reminiscences. Also, I should remember Professor H.S. Bhatt. After completing MCH, I worked at Puttaparthi Super Speciality Hospital under his guidance for 1 year. I learned a lot from him. And about Nandyala, I have fond memories in 2022 when I came to participate in Professor Ranganatha Rao Midterm Urology Conference. I was president of SOGUS at that time. I met a lot of friends and teachers at that time. Coming to today's topic, I am going to speak about a general topic which is very important. How we should balance profession and our personal life. I promise to be brief. Nowadays, we are seeing how much of a burdensome medical profession has become, starting from student days to practice days. Rising trend of depression and burnout. In this Western data, Medscape 2021, it is surprising to note that urologists are third phase burnout. I thought ours is a very happy branch till now. These are all contributing factors to urologists burnout according to Western data. Too many bureaucratic tasks, too many hours of work, insufficient salary, lack of respect from patients, government regulations, etc. Coming to Indian scenario, major causes of stress are not disease related. Complaints about room cleanliness, complaints about staff behavior, etc. are all coming into more important things for the patients. Nowadays, some people, especially software people, come after googling about disease and argue with us. We should deal with them very patiently. In private practice, surgeons face more stress as they have to deal with administrative tasks, RMP reference, lack of manpower and funding, etc. Difficulty in coping with increasing government regulations to run private hospitals and nursing homes. In corporate hospitals, MBA people, they will pressurize you, setting up targets. How many CTs you are doing per day, how much money per month you are generating, etc. They have long work hours with low salaries, especially young urologists. Lack of support from institutions. Institutes generally want their name to come up rather than the specialist's name. In government hospitals, there is lack of amenities. Even if they buy new equipment, it will get damaged in no time and a really long time to repair and make it functional again. Dealing with transfers, excessive political influences are also factors. It is said workaholism is more dangerous than alcoholism. Some people get excitement by doing more work, but relaxation is also very important. The common signs of work burnout are chronic fatigue during day and poor sleep at night, anxiety and depression and thoughts of work, feeling stressed even when you are away from work, and no motivation to work is other thing. How I balance these things? It is said 3 H's are very important: health, hobbies and happiness. Health is wealth. Without health, though you are having crores of rupees, you won't enjoy life. You should develop your own hobbies depending upon your choice. Happiness is the essence of life. You should feel satisfaction with whatever you do. Don't compare with others. Setting up proper timings for work and family is crucial. Proper diet habits are important. I never skip lunch. I follow lunch at 1 p.m. and early dinner at 6:30 in the evening. Patients will automatically follow your timings. Start on time is very important, be it in OPD or surgery. Plan your next day schedule beforehand and give proper instructions to junior doctors and staff. Once instructed, make hospital protocols and divide work among juniors and staff. Everything should work like a well-oiled machine. Complications and occasional delays might happen once in a while. Be prepared with a backup plan, be it in surgery or with staff. Daily exercise is very important. I will do it wherever I am, whether in home or in tours. Watching movies, singing and listening to music. Proper sleep is very essential to good health. What you can do is develop a hobby which suits your mentality and it will give you relaxation. I practice songs in the night times and gets happiness by singing songs. One small clip, if it plays, it is okay. It's your enjoyment. Then time with friends is another factor. You share your thoughts with and happiness or grief with your friends. Friends don't judge you. They take you as you are, as a package. Some reassuring words are all it takes sometimes to prevent negative thoughts. You should relax and become stress-free. These pictures we are called as 4 musketeers. Wherever I go, I will meet all 4 of us will spend time together. 5 ways to increase your patient satisfaction: accessibility, affordability, accountability and amicability, and ability also. With average abilities also, you can become successful in life if you are accessible, affordable and amicable to the patient. Comes to patients, our first motto should be do no harm to the patient. Do not deceive the patient. For a 3 mm calculus in the lower ureter and if the patient is in agony, we should not straightaway advise surgery. It will carry bad name for you in the long run. We should always think with patient's perspective. Counseling is very important. Do good to the patient and let the patient know about it also. If you do a difficult surgery, you should show operation pictures and videos to the patient and explain regarding what is the difficulty you have faced. It will carry good faith on you. Being seen doing good is also very important. Colleagues and staff, you should preserve relationships. Never badmouth a colleague in front of the patient. Take good care of your employees. We give scholarships to children of our staff members every year. There we should see the happiness in their faces. Every month we conduct a free camp and give medicines also for free. All these things will carry and good satisfaction for you. And you should treat staff like your extended family. Regarding time management, 3 Ds are very important. Delete, delegate and do yourself. We should delete some unwanted tasks like attending unimportant functions, etc. And you should delegate some work to others. Don't micromanipulate every work. And very important things you should do yourself. You should enjoy what you do and do what you enjoy. We should always strive to be in the growth zone. This is only possible once you will get out of the comfort zone and do the growth zone. For that one has to cross the fear zone and move towards learning zone. We should attend conferences and academic meets to stay updated. YouTube is the best learning platform. Previously we used it to travel at different places to watch people operate and how they approach cases. Now you can do the same thing sitting on your couch. Before doing lap pyeloplasty, I definitely see the pyeloplasty video of Malik sir, Dr. Mallikarjun, Dr. Chandra, where is Chandra? And others are our YouTube gurus. Invest in instruments and updating hospital is very important. Patients now Google before arrival. We should be prepared for mishaps. Complications and accidents can happen at any time. We should develop a backup support team. Maybe professional colleagues or locally influential people. An enraged group won't listen or understand scientific lessons. You should get professional indemnity insurance. One case can vaporize years of savings. Set aside a fund for emergency use which can be withdrawn immediately whenever it is needed. Optimize the compromise. It is a great motto for us. Learn positive things in adversities. What makes us truly happy? Find happiness in things you love. For me, it is my children's achievements which make me more happy. My daughter Swati has passed MRCOG in all steps in first attempt. My son Dr. Vivek, urologist, who is here, has graduated from PGH Chandigarh and AIMS Bhubaneswar, and recently he got Best Paper Award in Uro-Oncology Conference at Hyderabad a few months back. He is now learning robotics. Most importantly, to all youngsters, you should take care of your wife and she will take care of your life. Don't disagree with your wife. When you are bound to have stress in the hospital, it is prudent that you minimize your stress at home to zero. Every year I go on a family vacation. Grandkids are our best stress busters. Thank you for this brief talk. With these small tips, all of you become stress-free. Stress can also be relieved by walking on glaciers in Alaska or in snow in Scotland. Thank you very much.
Thank you, Purushottam sir. Thanks for accepting and delivering the oration. Your oration is a great advice to the youngsters and other professional colleagues, and it has given much moral boost also. Thank you very much.
Thank you very much, sir.